Hello, and thank you for joining us for another episode of Hope for Healthcare with Dr. Katie Cole in partnership with ICD Healthcare Network. Dr. Katie Cole is a holistic physician, organizational well-being consultant, and change agent, working with industry leaders in proven strategies to heal our national healthcare system and our culture of medicine. Stay tuned to hear today's speaker.
Well, welcome to Hope for Healthcare, everyone. Today, I have a very distinguished and well-known guest, Dr. Jonathan Ripp. He is Professor of Medicine, Medical Education, Geriatrics and Palliative Medicine, Dean for Wellbeing and Resilience, and Chief Wellness Officer for ICON School of Medicine at Mount Sinai. In the role of Chief Wellness Officer, Dr. Ripp oversees efforts to assess and provide direction for system and individual level interventions designed to improve well-being for all students, residents, fellows, and faculty at the Mount Sinai Health System. In addition, Dr. Ripp is also the co-founder and co-director of CHARM, the Collaborative for Healing and Renewal in Medicine. Well, Dr. Ripp, I just want to thank you for being here today. I'm so excited to have an empowering and an insightful discussion with you.
Thanks so much. I'm delighted to be here.
Well, can you tell our audience a little bit about your background and how you became interested in resolving healthcare burnout?
Sure. Yeah. My story is a little bit circuitous, or there wasn't necessarily a clear path, largely because I've been in this space for almost 2 decades. And back when I got interested in this kind of work, there really was not much happening in any sort of formal way. I'm trained as an internist, and I still practice here in New York City through Mount Sinai. Came here for my residency, and when I started almost 2 decades ago as a junior faculty, a general academic internist, I sort of began thinking about areas that might be an area of focus, an area of academic focus, and I just became really interested in ideas around how residents, in particular at the time, how residents change psychologically, and the impacts of training on the resident during that whole process. It just kind of fascinated me and became an area that I began to explore. And I would never have predicted that this is where I would end up, starting from that. But really, I started from a place of wanting to study the issue. So began doing some small research studies, survey-based research studies, just here at Mount Sinai. And as I moved along in my career, I began to explore and find similar, like-minded researchers at other institutions, and very slowly over time, kind of expanded the scope of our research. And then kind of, in many ways, I sort of picked a winner, as it were, when it comes to an area that would be my career focus, because I was able to kind of contribute to and follow the tide, follow the momentum that was clearly mounting in terms of both recognition and attention to issues around healthcare worker and trainee well-being. I became an associate dean first for resident well-being, and then just under 5 years ago took my current role as chief wellness officer. In large part, I think when you start paying attention to any one group, other groups sort of starts to speak up and say, what about us? And that's kind of what happened. There became increasing recognition and also the foresight of the dean of the school to whom I report, that this was something that needed a larger focus, a larger administrative commitment. And that's where my position came to be. Doing a lot more nationally, but I'll get back to you, let you take it from there.
Well, that's great. And, just thank you so much for the work that you're doing, Dr. Ripp. And I applaud your leadership at Mount Sinai as well for recognizing that this was a much needed endeavor and investment for your group. Yeah.
Yeah, no, indeed. And it's been a journey. And this work is it's about perseverance. So in many ways, we're talking about culture change. We're talking about trying to change the way in which healthcare is practiced, and so that's not quick work.
No, you bring up a really good point. It definitely is more of a longer term strategy when we're talking about shifting culture across an entire healthcare organization. As a chief wellness officer, what are some of your key strategies in creating a healthier work environment for your employees and students and residents?
Yeah, so I think the way I would answer that question is first by defining what a chief wellness officer is, at least how I see the
Yeah.
role. And I think it's a very new role. When I started just under 5 years ago, a quick search, I found three other people in the country at the time doing the work under that title. I through Charm, we have a chief wellness officer network for which there's about 50 members right now. So that's all changed. It's all evolved over the last 5 years, but it's still a very new position. So to talk about what our strategies are, really, we have to define what it is. And so in my view, the chief wellness officer is the person who oversees a team, and that team has the responsibility for bringing the expertise to be able to do a lot of measurement around well-being. So being able to understand not only how well or not well different segments of a large healthcare system are doing, but, and perhaps more importantly, understanding the drivers that are at work that are influencing those outcomes of well-being that can be measured. The drivers are critically important because it informs what we do and the strategies of which you speak. In addition to gathering those data, we have to be able to analyze and digest the data, and then in many ways lead by influence. The types of drivers that are at work that are influencing the well-being of our workforce are so large that it would be impossible for the chief wellness officer to do what we do and also oversee initiatives to impact those high-level drivers. So what do I mean by that? We need to be able to measure what these drivers are, analyze, digest it, and then bring that information to a host of stakeholders within a healthcare system who can then effectuate change, whether it's a department chair, whether it's a unit lead, whether it's the chief nursing officer, folks in HR, folks in informatics, folks in operations. We need to be able to bring this information and say, you know what, in this particular group, it's the electronic health record in basket that's driving distress, or in another group, there are staffing ratios, or in another group, this group really is not feeling valued, or is not feeling like their leadership supports them, or is not getting communications around what support there is. Or maybe there's a group that's having a lot of psychological distress, but we're just coming out of a pandemic. And so being able to measure that, being able to bring it to the people who can effectuate change, and being able to tell a coherent story around how to move forward, that's the infrastructure that we oversee. We do so with a group of well-being champions that are people in given spaces embedded within a healthcare system who can interface between us and the leaders to help come up with the solutions. A lot of times those solutions, the strategies are focused on system level change, on enabling people to be more efficient and effective in their work in a place where they feel valued. It's our belief that if we can understand what are those barriers that are getting in the way of people doing their jobs efficiently and effectively, because healthcare, fortunately, is there are careers in which there's inherent meaning that can be derived from the work. We just need to unlock it. We need to enable people to derive it and make it so that they can do their work. And then similarly, and there's lots of data from other even outside of healthcare organizations that really have that culture piece where people feel like they're part of something special, like they're part of something that's meaningful, that they're mission driven, and that they're valued and respected. If you can create a culture like that, you can create a really effective organization.
Wow. So it sounds like, one of the things that really stuck out to me is that you really tailor your initiatives toward, the actual drivers for each group, because, you cover an entire healthcare organization and system. So like maybe one medical group might be suffering, like you said, from more psychological distress from the impact of the burnout, versus another maybe dealing with more of a flow issue. And so you're really looking at those individual drivers of burnout and then creating strategies to at a system level to change those.
Yeah, and the understanding the specific drivers and understanding them by given group is a key piece of this. Because though we are all in healthcare, the drivers that are going to be positive or negative as it relates to well-being are going to be very different in an ambulatory versus an inpatient setting. In nurses, compared with physicians, compared with other healthcare professionals. And then even within, a given discipline, there's going to be lots of variability. So even if you take ambulatory physicians, there's big differences amongst the specialties. So it's important not only to gather the drivers and be specific about them, but also to understand that they vary by constituent group and create a structure where you can come up with plans to address those drivers based on a given group. And the other important point to make is that there's that well-being is complex. There's many different drivers at work, and so you're always going to identify more things than you can address at any given moment. So being able to prioritize a given driver or phase in your approach. Maybe this year we're gonna address the in basket. Next year we're going to address staffing ratios. The year after we're going to do an all-out kind of leadership training. Kind of identifying things that you can not boiling the ocean or biting off more than you can chew, but really trying to be effective in identifying given priorities, to prioritize them and to address them in the order that they have importance.
I'm curious, Dr. Ripp, how are you able to engage the leadership and healthcare employees on embracing the initiatives that you're rolling out? How do you get them to become, more passionate and enthusiastic, given in the past, maybe initiatives were rolled out that just created more work and extraneous cognitive load?
Yeah, well, I started by kind of giving you in broad strokes what the job description is for the chief wellness officer, which is sort of, we bring the expertise to do the measurement, we analyze, digest it, bring it to stakeholders, and help identify solutions to address the priority drivers. That's how I would describe it. When we talk amongst ourselves, if you pull the curtain back, you realize that much of the work of the chief wellness officer is doing what you just said. It's making the case and building those relationships to engender the kind of buy-in that's needed to make change at the system level. And so I spent a lot of my time cultivating the relationships with the people that actually I need to engage with, so that they understand what I'm doing, why I'm doing it, what the implications are, and what needs to be done to make change, and why that's in their interests also, right? So oftentimes healthcare organizations are priority rich. They have there's just one priority added on to the next, and so well-being should not just be one more priority. It really should be. It should be aligned with other priorities that stakeholders have. To make an efficient electronic health record is not, you don't do it just because it makes the well-being of the user better. You should, but it's also because it helps to be more efficient.
Well, and I'm sure that you've had a lot of experience with, rolling out initiatives and trying various programs. Is there any one or two lessons that you've learned along the way that has really helped you become more successful in the implementation?
the first thing I'll say is that the actual program delivery that comes out of a chief wellness's office is going to be limited. So if you're talking about overseeing the initiatives that are likely to have impact, then it's actually what we do is we gather the information to bring to the people that we're trying to influence, and then encourage them, partner with them to roll out the initiative. So I guess what I would say, the lesson learned, which really is a lesson that I think probably extends beyond just well-being leaders, but is really a lesson of leadership, is ensuring that that all the right people are in the room, right? So when you anticipate and you're desirous of making a change at such a large system level, you got to make sure that all the right people are there to make that change, because for a couple of reasons. One of which is you're going to be ineffective if you don't have the people in the room who actually know how to make things change. And then the other reason is you might ruffle feathers, right? So if you're not taking into account those leaders who are needed to make the change, then sometimes you can kind of shoot yourself in the foot, so to speak. I think it's a general lesson of leadership. Is everyone who needs to be here in the room so that we can hear their thoughts and collaborate with the people who can really make the change happen.
Yeah, that's a great lesson. You make a really good point, and I'm sure it takes a lot of experience and knowledge to even pick the right leaders and to identify the leaders that are going to help you be successful.
Yeah, I would say I've had the fortune of being at the same institution for more than 2 decades, so that helps. It helps. On the other hand, when I entered the position that I'm in now, it's very fair to say that I needed to meet a whole host of new people that I just hadn't really engaged with prior to, because of where I was situated and the work that I was doing. So that can't be underemphasized, that it's work. It's really work to get to know who in a system are the people that can actually make the changes, and who are going to be your partners, and then who are the people that you got to work on, who are the people that don't get it, or who are the people that maybe don't see eye to eye, or maybe hear you but think of you as just one more priority on a long list of priorities. So that is the work. That is a lot of what the job is.
And possibly some leadership training along the way as well for your up and coming leaders.
Yeah, I mean, leadership training is the way I think about leadership training is that there's some elements of leadership that are more natural. There are just more natural leaders than others, right? There's some that just take to it. And so what we believe is we know there's evidence to support that the behaviors of leaders really influence the well-being of the individuals who report to those leaders. And but there's a wide variety of leaders and leadership skill. And some people become leaders because they have those skills, and others become leaders for other reasons. For us, it's about kind of, rising tides raise all ships, right? So it's not like we need everybody to be, to exemplify perfectly all of those domains of leadership that promote well-being. But if we can move everybody up a bit, then we think it's going to have, a beneficial impact on the entire community by just by prioritizing and bringing to light that this does have impact, that the behaviors exemplified by leaders actually has an impact. By bringing that to light, that's a win in and of itself. That's us saying we are a culture that recognizes this, and we may not have it perfect right now, but we're working to make it so that these behaviors are recognized and that leaders are exemplifying them more often.
And that's really a powerful way to shift our culture of medicine, as well as to be investing in leaders and employees as well. So thank you for doing that work.
Yeah.
And I know, Dr. Ripp, I wanted to ask you a little bit more about CHARM. I know that you're the co-founder of that organization. Did you want to talk briefly about some of the initiatives that you're working on nationwide?
Sure. CHARM is in the process of incorporating. It's our hope that what started as kind of a grassroots group of like-minded individuals who are coming together to do more than just talk about an issue or research an issue, but wanting to actually take action, is now in the process of what we hope will become the professional home for well-being leaders, a place where we have a series of networks for different levels of well-being leaders who meet regularly and learn from each other, become educated, educate each other, and work on collaborative projects. We also have some educate. We run courses and we do some collaborative research together. So we do a fair bit of education. And so, I think it's our hope that it'll just continue to expand and function as that place where, if you're a well-being leader, it's where you consider your home.
Oh, that's wonderful. I'm so glad that you've created that. And it's definitely necessary, especially for growth and evolution as we're trying to, really clearly define the role of Chief Wellbeing Officer.
Yeah, we're working on it.
Yeah. Well, Dr. Ripp, is there any last key message that you want to leave with our audience today?
Just that, I remain optimistic, even though times are really challenging. I think, it's fair to say there's more threats to well-being of the healthcare workforce than maybe there ever were. That's arguable, but there's a lot of challenges. There's a lot of challenges that are at work to undermine and erode the well-being of the healthcare workforce. And yet I do think we've never seen more attention to this issue than we have now. And so I think with that attention is going to come recognition of solutions that really do make an impact. It's unlikely that we'll see change immediately. And quite frankly, some of the challenges may get worse before they get better. But I think that the future is definitely brighter as it relates to the practice of healthcare. I think inevitably we're going to address some of the issues that are challenging us today. There probably will be new ones that emerge, but that means that our work is necessary and will continue. So I thank you for the opportunity to share about what we're doing.
Absolutely. And it's been an honor and pleasure to have you on the podcast today.
Yeah, thanks. Thanks so much for having me.
Well, and everyone, I will have Dr. Ripp's information available on his bio page on the website. Plus, we'll be posting in social media and LinkedIn. So I also will include any information Dr. Ripp would like to have available to you as well, in case you want to reach out to him. And thank you, everyone, for tuning in to Hope for Healthcare podcast. And we look forward to seeing you again. And thank you again, Dr. Ripp, for your time today.
Thank you.
All right.